Welcome back to Africa This Morning. We are now on Table Talk, and today we are hosting Dr. Catherine Mutisya, who is the Head of Substance Abuse Management at the Ministry of Health. Thank you so much for joining us.
Thank you.
Let's discuss the issue of substance abuse in the country. When we are talking about understanding substance abuse, do we have the right information as a population? Are we responding right?
I would say, at least in Kenya, for now we have seen some degree of involvement of the leadership led by the president, and we are also seeing members of parliament getting involved with it. That's where we start, but we still have a lot more to be able to help those who have been identified to have addiction problems and to also prevent. The society also doesn't understand much, because we know in our society people would still think if somebody is addicted to alcohol, probably they've been bewitched or they need prayers, and that would be the first option they would go for. So a lot more needs to be done. Yes.
When you're looking at the thumbs up that you have given the country at this point, the pronouncements that have been made on the political platform have been very positive by breaking the ice and breaking the stereotype that we do not want to deal with the reality that substance abuse is with us as a country. However, the population has been mobilized to deal with it on an aggressive front. There's a huge gap here, as you mentioned. What more needs to be done to get us to that point we are able to understand substance abuse, and comprehensively so?
First of all, I need to say we have a national treatment guideline for substance use disorders, which unfortunately has not reached to all corners of the country. And the Ministry of Health has a protocol of how such substance abuse should be handled. Most of the time, it's wrong to go get somebody from the substance they're addicted to when you have not planned for the right treatment for them.
Yes.
Yeah, because if somebody has been addicted to a substance, then they stop taking it and there's no replacement treatment, then it means the withdrawal symptoms can actually overwhelm them, and you can even scare other people who would want to start the treatment. So it's the ideal would be, let's plan as we get people from the substance they're addicted to. Let's have ready treatment. I have faith that if all health workers were sensitized and given refresher courses on how to manage substances well, they can be managed even at the health center. If that is not possible, then they can be done at the sub-district, sub-county hospitals, and finally referral to the county hospitals. And that's why the Minister of Health recently saw this issue was a big one, and they created a department of substance abuse management, so that we can actually be at the grounds, we can have policies and we can have action plan and strategic plan to be sure that right at the grassroots that whoever needs treatment can get it. And also we also need to come with programs to prevent, because we shouldn't just sit and wait for people to get addicted. We also need to prevent.
You've indicated that the treatment plan has not been disseminated to all parts of the country. What would you attribute that to? And maybe is it linked to the fact that when you're looking at addiction, we are not prioritizing it as an issue that is worth significant attention? And how do we need to change that?
Yeah, I would say that at least now we are realizing this is an issue which needs all the energy and all the zeal to deal with. And I must say the national guidelines I'm talking about, they were developed in collaboration with the WHO, World Health Organization, and UNODC, the branch of the UN which deals with substance abuse. And so it's a very well thought guideline, and we are in we have started aggressively distributing these guidelines, and we are working towards a program where we do not just distribute, then we also retrain health staff, because most people were not seeing addiction as a disease, and we know there are still some health workers who up to date are not accepted the idea that addiction is actually a disease which needs to be treated. So we need to actually aggressively continue disseminating it, continue having continuous medical education, so that everybody can be doing the right thing. But we also need to tell the public that you can get this treatment and this is where you can get it. Many people, when they think of substance abuse, they think of residential rehabilitation, what is commonly known as rehab. There are 3 ways of managing substance abuse depending on the level. We first of all have outreaches. And that's why you see in places where there are heavy drug abuse, like in the coast or even some areas of Nairobi, we have programs of some non-government organizations where they identify people who have recovered from, or who are in recovery from substance abuse, and who their peers can actually identify with. Go to the dens and start identifying with them with the aim of winning them to come and start treatment. So somebody who doesn't understand, when they see an NGO going to the dens to talk to those people, they don't understand that part of our treatment protocol is the outreach, where you have, and this person who is addicted to substance will identify better with somebody who has been in it and is recovering. So we start with the outreach, then we come to outpatient. There are people who can be treated on an outpatient. And then the severe cases are the ones who are treated as residential, where most of their time is 90 days treatment. We also realize that most of the residential rehabs are not doing the right thing. They do not have the right professionals. And we are also going to streamline that and make sure that they're offering the right treatment.
Let's talk money at this point, considering that the strategies that are going to be adopted will need us to pull from the great policies that we have. In as a country, we are always known as a country that has great policies, but translating the policy into action has always been our problem. How are we investing financially to ensure that when it comes to training, it's consistent and it is thorough? We are looking at outreach programs. We are looking at ensuring that the facilities that we have when it comes to residential rehabilitation centers are going to be sufficient enough to deal with the challenge from the ground. How are we going to deal with that financially?
We are aggressively looking for partners to work with, and there are many partners who are willing to take up and help us with the cost. And we, like now from here, when I leave this discussion, I'm going for a meeting where we are going to have all the stakeholder and governmental organizations who are dealing with substance abuse and being housed at NACADA, National Campaign Against Drug Abuse, and we are going to chart the way forward. Where are we and where are we going? So we are going to partner with people. The government is committed, and especially the Minister of Health, and that's why they saw the need to create this department, so that we can actually be able to fight substance abuse from the health aspect as much as the other aspects of the government are doing their part. The health role is also very important, and so we are going to actually have all the stakeholders support so that we can complement what the government is doing.
When you're looking at institutions such as NACADA, they've been faulted by having some of their financial allocation not accounted for. How are we going to ensure that even during this new chapter of dealing with substance abuse, we are conscious enough to understand the financial allocation that is given to different agencies and support agencies to the ministry? They're going to be working together to ensure that that money actually goes to working for rehabilitation in the country.
I would leave that to the necessary arms of the government, which are supposed to make sure that public money is well used, and I believe they are there and they should do their role. And part of our work at the Ministry of Health is the technical work to advise. If this is how things should be done, let them be done that way. If things are not being done well, let us advise, give the technical advice. But we will also, as we sit in the technical working committee, we'll point out if we see obvious misuse of public funds. We also have the duty to actually make sure, because as of now, that anybody can report when they are convinced that public funds are not being used
allocated in proper manner.
Mm.
When you're looking at the scenario that we're in at the moment, we are in a devolved system of government. The campaigns that are being spoken of during this sitting are going to focus on a national. Are there conversations that are going to be very specific county to county to deal with the challenges that are being faced in special regions? For example, you're looking at the coast, the drug challenge. When you're looking at the central part of the country, alcohol becomes an issue. Are we going to be focusing on specific issues in specific areas with the help of the county government?
Yes, we can't deal with health without considering the county governments, and the Minister of Health as a department of intergovernmental, because we consider the counties as governments. There's the national government and there's the county governments. So we have a department of intergovernmental affairs where we have a clean way of liaising with the counties. We also have the National Ministry of Health as arms throughout the counties. We have what we call county coordinators who report to the national government. So there's a way, and the national government has the mandate of coming up with the policies and making sure the policies and the guidelines are are followed up, regardless whether you're in the county or you're in the national government. So we can still do that, and we'll do that, because if we, part of the health is to make sure that you are able to treat substance abuse, because every Kenyan has a right to attain the highest standards of healthcare, including substance abuse, including mental health. So if we say then every county should be able not to discriminate, should be able to provide treatments for everybody, then we are going to follow the right legislations to make sure that the counties do that. But we have a way of, a systematic way of coordinating with them. If I may go back to the program you have talked about, what is going on at Mombasa, the MAT Methadone Clinic, we know that it's actually coordinated by NASCOP, which is an arm of the national government. So again, that's an example that the counties can still work with the national government. When you look at NACADA is also penetrating in all parts of the country, yet it's still a national government. So we are still working with the counties.
When you're looking at issues of substance abuse, it's not only a branch or a standalone issue on the corner. It is a multi-sectoral problem, because it links up to crime, it links up to health issues. How are we ensuring that it cuts across several ministries so that we're able to deal with substance abuse and the impact thereof right from the top?
Yes, you're right, because we also realize that some people who are addicted to alcohol find themselves in the courts and some even in the prison. And we will also be able to help work together with as of now, the Mental Health Act. There are ways you can actually be able to assist somebody who has been found to offend, but they are either addicted to a substance or they have a mental illness. So the Mental Health Act has policies to deal with that. But our aim is also again to prevent, so that we don't go that deep. We also realize that substance abuse has other complications. For example, HIV for those who are using injectable drugs. Also, alcoholism will affect the liver, will affect other organs of the body. And that's why we are saying we cannot win the war of substance abuse without involving like the other specialties of health and also intergovernmental. That's why we are seeing we are going to look at all the stakeholders and involve them.
To get the conversation on the table with everybody involved.
Yes, yes.
When you're looking at substance abuse, let's touch on the community. You alluded a little bit earlier on the need to empower the community and engage them positively when dealing with substance abuse right from the home. How are we ensuring that we move the community from the mobilized state of aggression to a point of understanding and being very conscious on the reality that substance abuse is actually a disease?
Yeah. I appreciate that you've given me this opportunity and we are discussing this topic. This is where it starts. We need to pass the information through all forms of communication, through media. We are also having very aggressive social media campaigns. We have Twitter, we have Facebook, and email. You can reach us.
What engagement is offered on those social platforms for the community to offer?
We are offering information about substance abuse and all forms and how you can seek help. And I believe, because especially the youth, many youths get information through the social media, so we cannot ignore that. We are also approaching media houses like Hebrew to be able to give us airtime to educate the public. But of course, we are going to use also the official communication. We are communicating with our members of staff throughout the country, through emails, through organized seminars, and through conferences to be able to pass the message. Yes.
When you're looking at, let's say, traditional forums that can be used to convene the population, we're still in Africa. We value coming together. How are we going to ensure that even during forums that are held in the grassroots, in the urban centers, using the county governments, that we can get that as an opportunity to offer information on sensitization in relation to substance abuse?
We are right. Whenever we are starting any program, like if I may give the example of the MAT Methadone Clinic, which is now running in Nairobi at Mathare National Teaching and Referral Hospital, and it's also running at Coast General Hospital. When we are going into the program, we engage all the stakeholders, including the community. Remember, I've said that even to get the people who are addicted at the dens, or if it's alcohol at the bars, the right protocol would be engage the community, people who know them. And the part of the civil organization bodies which are reaching the people also involve the family, because there's no way we can get somebody to come for treatment when they have no social support. So we have social workers on the ground who actually reach to even the families, and that's how a proper program which will be sustainable is done, not to just go and all over and throw alcohol and assume the problem is sorted out. When you do it systematically, get the stakeholders, involve the family, so that these people have support, because you're not going to carry them as a health worker. You need a family to support them. So when you do it that way, including the elders in the village or in the community, then you are able to succeed better than when you do it at the top. Of course, it was good we started somewhere. There's always a start, but now we are going to streamline and make sure that everything is done well.
What are some of the challenges you're facing when dealing with the reality of substance abuse as a challenge and as a problem in Kenya?
The challenge is the problem is so big such that people wonder, what are you doing? Are you even starting? And it will take a while before you can convince Kenyans that you're actually doing something. But we are not discouraged. We'll do our best because, you know, good programs begin with good plans. And we also we are sensitive that we want to do programs which are sustainable and programs which will also prevent, so that we don't just wait for people to treat. So the challenge is the expectations. People expect us to do miracles immediately. We'll do our best, but it takes time to eventually see the results. Like in 2 years, we expect to have reduced whole rates of new abuse among even adolescents. Like yesterday, you saw in some of the media houses, there were some adolescents who are found taking alcohol and other substances. The other day, we read a school bus from Central was carrying youths from school, high school, who are abusing substances. So we need to begin from there, and we need to begin from the family. The war has to be won from the family, from the schools, so that as the children grow up, they realize that substance abuse is harmful to your health. And we know that some substances which are legal, like alcohol, you know, we've been very obsessed with the second generation alcohols, and we forget that even the more expensive thought to be normal, legal beers and alcohol are also harmful if somebody gets addicted to them. So we need to pass the right message. Even with small things, common things like cigarettes, there's a lot of cannabis in the community. We need to give our youth the right information so that they know, if I start taking these things, my health is going to be affected, my performance in school is going to be affected, and overall, my productivity as a human being is going to be affected.
That is a conversation that touches on data. How accessible or how easy has it been for you to compile actual numbers that will link up to the reality on the ground? Because when it comes to admitting that my child is addicted to a certain drug, it touches on almost the taboo area, and people are not really willing to accept that as a reality. How are you working with collecting of data so that you're able to ensure that if we adopt a policy, it is directed to unintended efficacy in society?
Yes, we realize that there's a challenge on the research which has been done. The Ministry of Health has a way of reporting all the diseases, including substance use disorders. But like I had earlier mentioned, most health workers are not even conversant with the diagnosis and the management of some of those disorders. So then that's why we need to streamline that, the reporting. We also having community studies which have been done, like NACADA has done several surveys. We are going to use that. And overall, we are also going to partner. Like in November, we are going to have a symposium at Kenyatta University, where we are going to have all the stakeholders making presentations, all bodies involved in the management of substance abuse on November 19th. They will come and present in that symposium. And from there, we will see where we can start from, even the research aspect, the treatment, is anything we can do better. So we are moving, but eventually you'll start seeing the results.
Thank you so much for joining us, Daktari. And of course, you're going to be able to highlight to the viewers that there's going to be a focus on mental health later on in the week, the 10th of October, with the theme of dignity in mental health, which you'll be in charge on, and we'll be focusing on bringing the viewers an opportunity to get that highlight in our bulletin. And of course, we have Dr. Siengo here, who's given us an idea of some of the challenges when it comes to mental health in the country and what the ministry is doing to begin the progress in getting the country to be more sensitized when it comes to mental health and specifically substance abuse as well. From the team and myself here at Ebru Africa, enjoy the rest of the viewing right here.
Erickson. Sema unasemaje? Erickson. Unasemaje? Yeah. Oxy
3. Oxia mic 3, that is.
Nataka kujisikia.
Unataka kujisikia? Ndio hiyo.
1 2 aya. Hapo iko sawa usi nini?
Okay.
Wacha nisikie kwa sababu cable hapo iko tight.
Yeah. I think the frequencies hapo hivyo.
Sasa
frequencies
unajua tena ni ile ya kutoa lakini sasa inakatakata mbona?
I think basi hiyo ni
bado ni frequency.
Hapana. Kama venye ilikuwa na behave labda ni hiyo.
1 2 1 2 1 2 1 2. Cause
ndio hiyo. Unafanyaje?
Ilikuwa hapa haikuwa hivi. Hii ni kurab na rab. Like ina rab
Cheki. Kaa kwa kiti hapo alafu try ku make movements.
Hizi mainzi zimekuwa mob huku bana. 1 2
kama kwa kiti alafu at least ukiongea ugeuke. Yeah, naisikia.
Hiyo ni wacha tuone kama itakuwa bado. 1 2 1 2. Material yenye kwa KMC inaweza run for more than 6 months bila kujirudia. Content iko. Photo stories zenye ziko 3 minutes zenye ziko na si film peke yake mpaka TV. Mpaka TV. Sio nyinyi tu. Na zilianza kutoka kitambo sana.
Tumefanya kwanza kila mtu alifanya story yake. Unaona kuna drama
ziko.
Kuna drama, kuna docus, kuna features, kuna
ziko a lot. Hiyo actually mimi naona ni kama zinaweza more than a year without kujirudia. Yes.
Iko poa, mimi sisikii tena.
Na sasa shida inatokea wapi? Ya hii microphone. What is wrong with this microphone? Hizi
inaekonga wapi?
Labda penye. Hii ilikuwa tight. Nimekaa mtu nikapata iko. Bonge. 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2
hivyo.
Yeye kama alikuwa anaguza.
Basi alikuwa anaguza. Hiyo naisikia.
1 2 1 2.
Hiyo.
Hapa iko tight lakini sasa hapa ikimove.
Unajua alikuwa ameyekelea kwa kiti. So labda alikuwa anasonga songa.
Anasonga songa.
Hakuwa amevalishwa.
So vile itakuwa inafanywa watakuwa wanadungwa kwa bra. Tito kubembeleza.
Tito.
Yeah.
Waambie tuzimie kamera please.
Sawa.
Nimeifanya interview ya James Mwangi na nasikia nashindwa hii ni nini.
Erickson nivo
ama acha tu 1 2 1 2 niweke tu aux usiboeke 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 like Boniface is doing he's turning that knob and what you're going to see is that Boniface the gibist will yes try to get where the problem is and now we found where it is. Now he's going to shake it a little bit to ensure that you see that yes 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2. Aya sasa sawa. Aya alafu sisi watu wa menje wazimiwe.
Sawa sawa.
Aya sasa from today hizi mics zinaenda kwa bra. Hakuna kubembeleza. Hii story tutaki maneno bana.
Kwa bra.
Kwa bra.
It's very hot there.
Oh my.
Yes.